I got a nerve injury at RSD, and that caused fibromyalgia. My orthopedist, who was helping with the RSD, highly recommended Dr. Franco. He is fantastic. He has the same type of beliefs I have. The treatment he gives, he works with however you feel and whatever is right for you, and I believe in the integrated medicine, which is what he practices. He is one of the few doctors I've ever encountered who actually listens to you, who does not push you or rush you through. If you need to talk to him, you get your time, and he keeps up with everything. We talk about whatever's current, what's going on as far as treatments for this condition. So he is forever, always keeping up with the information, so he's current, and he's doing what's best for his patients. I have recommended Dr. Franco a number of times and will every opportunity I have.
Well, I got kind of lucky. I got referred to Dr. Franco through my primary care physician. I had a real bad scleroderma crisis, kidney crisis, caused congestive heart failure and total renal failure. My primary care doctor remembered a patient who had it and was getting better, and so he called this doctor and got the referral for me out here to Dr. Franco, and frankly, then things got better. He's great. He's great. You feel like he cares. He does care. That's not a feeling, it's a fact. And your improvement matters to him. And when he gets a patient like me that responds so well to his treatment, it's a validation of what he's doing to go on. So he's a good guy. I like him a lot. And my other doctors are blown away, you know, because like my kidney doctor, I see him on a regular basis too. And he's just stunned by the progress, because my kidney function had dropped to 12 and dialysis is 10. And he told me at the beginning of this, before I started seeing Dr. Franco, that I would be on dialysis within a year. And I've never, Dr. Franco's therapy and everything has really turned everything around for me.
I was diagnosed at UCLA, severe systemic rheumatoid arthritis. And I went to the library and got a lot of big medical books, because my dad was a medical attorney. And so by the time I got done with these books, I did not think I had a very good prognosis. But then I read this study using antibiotics, minocycline, in rheumatoid arthritis. And in 11 months, the people who were on the minocycline at 5 university hospitals across the country, their disease level dropped by 50%. And the thing the researchers hadn't even expected is their lab scores. The improvement was profound. I was going to an excellent doctor that I completely trusted, and I was taking a clipping that this treatment had been approved, and he kept telling me that he had better medicine. And in the meantime, I couldn't even drive anymore. It went from my feet to my jaws in 5 months. And then he told me that he was going to have to put me on, more immunosuppressive medication. And when I said, I don't understand why you won't let me try this, he admitted he had been trained in antibiotic therapy and that he would give me that treatment if I insisted on it. Well, I felt like there was no more trust between us, and so I left.
Yeah.
I tell people, don't bother going to a rheumatologist until you call them and have their receptionist call you back and tell you if they are willing to let you try antibiotic therapy. Dr. Franco is like a good guy that cuts your hair. Until he's satisfied, you don't get out of his chair. You know, he doesn't breeze in and just, you know, halfway take care of you and then leave you. And Dr. Franco was very frank with me. Good. He said, you are older, which I was 54, and he said, you know, I don't know if this is going to work as well for you. And the first month I felt better. The pain left my jaws and I was sleeping better the first month.
A lot of people didn't think I was even going to live, so I was that bad. But he is my savior. I love this man, and I thank God every day that my son found him. You know, I wouldn't be here today. So it was a bittersweet experience, but these people here are the absolute greatest, just the greatest. And he, of course, is brilliant, and I believe in him. Believe this, he saved my life. Through God, he saved my life.
I got a vicious case of rheumatoid arthritis, numbers hundreds of times normal, and I was in a lot of pain. I was in pain all the time. I was tired all the time. 8, 10 hours sleep, up for 3 hours. Oh man, I needed a nap. What the first 2 rheumatologists offered me was too grim to even consider. It was, well, got a vicious case of rheumatoid arthritis. We have no idea what causes it. Here's some basically chemotherapy drugs to help you ease the pain, but we don't know what they do to you either. So, best of luck, basically, is what they said. I mean, really, when a doctor gives you an immunosuppressive drugs and you take the time to read the box and you see that if you take this, in 5 or 6, 7, 8 years, you're going to be thousands of percentage points more at risk for all kinds of lymphoma and all kinds of lung-related diseases than you ever would have been before. A regular doctor will tell you that it's your body eating itself. We don't know why. The reality is there's pathogens, there's bacteria that have been in your body, have slept there, and they wake up at a certain point and start causing inflammation in a certain system of your body. So thank God for the internet, because on the internet I found Dr. Franco and the Arthritis Center of Riverside. What 98% of arthritis sufferers, rheumatoid arthritis sufferers, do is that they take symptom-suppressing, immunosuppressive drugs that really start to harm your immune system after a while. So I made another choice and chose to do a long-term remission protocol with Dr. Franco. It's allowed me to cut my numbers from like wildly off the charts to the presence of long-term inflammation in my body is almost normal now. Some people want a higher quality of care, I guess you could say, or more, or a person to work on them or their house or their car or whatever that's more kind of owned in. They're better. They're like an artisan. He's like an artisan doctor. He's completely passionate about it, and he's owned in. This is his priority, and you can tell it. And it's way different than other doctors. Believe me, I've been through a lot of doctors. He's made the difference between, you know, hope and no hope.